Sir is actor and also fitness freak. These are team the last 2 years working on. Ashok helped me the last 2.5 years. Every time he is with me. For lunch.
Is it not closed? How do we close? Energy కొంచెం మాట్లాడిన తర్వాత
ఇదా Yeah. पहले मैंने I request everyone to please be seated as we are beginning shortly. I request everyone to please be seated and welcome back after the lunch. The food was amazing, so if there's any drowsiness, the caterers are to be blamed. But don't worry, we have excellent speakers with us. Healthcare today faces unprecedented challenges from pandemics and climate change to resource constraints and rising patient expectations. No single department, institution, or stakeholder can address these challenges alone. This session explores the importance of moving beyond isolated efforts and embracing integrated, system-wide collaboration among healthcare providers, policymakers, industry partners, and communities. The discussion will highlight how collaboration, shared learning, and innovative partnerships can create stronger health systems that deliver better outcomes for patients, protect the environment, and ensure preparedness for the future. I would like to request Dr. Ramesh Martha, HELP State President, Telangana Chapter, to kindly take the momentum of the discussion forward.
Yeah, good afternoon, everyone. I know that you cannot respond because we had a nice food and nice lunch. Madhya Pradesh is full. That then Purvanchal doesn't respond. Good afternoon. Hey, come on. Good afternoon, everyone. Yeah. Okay. So it's my privilege to stand in front of you and to introduce one of the traditional foodie. So he's running the farm and cave. But if you look his attire, you don't believe it. How he can run the cave. But even though he's mixing with the tradition with the modern, he's the one, Krishna McKenzie, founder of Solitude Farm and Cave, and pioneering voice for local food and culture identity. Not only is promoting our culture, our food, that is going to be our future. If we want to stand here, if we want to sustain all the people who are taken part of this conference, without food, we cannot move forward. Culture, nature is going to be our future. So, living in India since 1992, he has championed the vision that reclaiming our food is the foundation of reclaiming of our culture. Through his food forest, Krishna inspires institutions and communities to reimagine their landscapes and meals, awakening a deeper connection between people, land, and culture, and reminding us to return to what is inherently ours. We all should give a big round of applause to his parents. You see, his name is Krishna. It's not an ordinary name. The person who runs entire globe. Yeah, now I welcome our modern Krishna, our cultural Krishna, our foodie Krishna onto the dais. Please give a big round of applause. But we should thank to the Yashoda. They had given a nice food. I know blood supply goes to Madhya Pradesh. I will try to bring it to Uttar Pradesh also, Purvanchal also, because I'm confident that I'll make you awaken. So with that, and we'll move forward. Yeah, please, sir. And the next speaker? Yeah, over to Krishna, sir.
Which button? This one. Oh, it's too many things to hold. Okay. Color me. Yeah, give me a color me. I'm bringing the mic now. So I guess everyone is feeling a little sleepy after lunch. Please put your phones away. I came very, very far away to talk to you. So put your phones down and let me share with you my work of the last 30 years. Is that working? Yeah. All right. Is this mic working? Yeah. Okay. So namaste. My name's Krishna McKenzie. I'm from England, and as Sir told, I've been living here in India for the last 33 years. I'm not a doctor. I'm a farmer. I'm a musician, an actor, an educator, and I guess also you could call me a social media influencer. But what I've been doing for the last 30 years is observing the relationship between soil, food, health, and community. And I've come to a conclusion that we're spending vast amounts of money and resources on treating the consequences of unhealthy food systems while paying very little attention to what creates health in the first place. So in 1996, I started Solitude Farm, inspired by the Japanese farmer Zen master Masanobu Fukuoka. He's considered the father of natural farming and do-nothing farming. And he had a very profound insight that, you can't understand nature by breaking it up into parts. It's, it doesn't act in a mechanistic sort of paradigm. Nature's a holistic whole. And he went as far to say that only a fool will understand nature. The Japanese word for fool is a baka. So when I got to meet him in Vandana Shiva's farm, he said to us, only baka can understand nature, be a fool. And over the last 30 years, by following this, this is very hard to change the slides and talk at the same time, but I'll try my best. This is Solitude Farm. Over the last 30 years, by following his philosophy and his teachings, Solitude has developed into a vibrant and dynamic food forest with over 200 edible plants growing there. Now, these plants grow together due to the sort of principles of what we can call permaculture. They occupy different strata, they have a different physiological relationship, and they also have different time duration. So you have long duration fruit trees, medium duration plants like the banana, papaya, shorter duration plants like the haldi, sweet potato, the arabi, things like the soran, the elephant foot yam, shorter duration vegetables, very short duration spinaches, the sag, and then even the edible weeds. And when you go through this farm and you sort of see all this, you go, hang on, this isn't a farm, this is a menu. And you see that, you know, that these foods that are part of, you know, part of this, of solitude, they have no economic value. No one's going to buy, you know, a banana stem or this pink flower. This is called the parupukere, which is good for autism, ADHD, has full of omega-3, omega-6. People aren't going to buy, you know, over the jungly beng and the sundakai. So it has no economic value, and therefore they've become sort of, you know, marginalized by industrialized agriculture that wants us to eat, you know, carrots, potatoes, cauliflowers, cabbage, none of which come from India. And so the way to value these foods is through farm to plate. And so about 20 years ago, we started a farm to plate cafe where we value all these plants. And this cafe has become extremely successful. And it's made me understand that these local foods, they have particular characteristics. And to understand those characteristics is a really important thing to consider. So the first characteristic of local food is that it grows easily. There's no effort in growing local foods. If you take, for example, the moringa, you guys are familiar with moringa? The drumstick spinach. So you take off a branch of that tree and you plug it in the ground, it germinates. There's no effort. You don't, you know, that's just a common knowledge. There's nothing esoteric about knowing that. And because it grows easily, it grows everywhere, it grows in abundance. Something that grows in abundance takes on a very noble characteristic, and that characteristic is non-exclusivity. That means a beggar and a king can equally eat the drumstick spinach, but only rich can have the pizza. The second characteristic of local food is that it is a medicine. You know, in Tamil we say, "Unuve marundu," food is medicine. And you start to see, my God, this isn't a farm, it's really a pharmacy. You have like the black velvet bean that is 4 to 7% L-dopa. It's a precursor of dopamine, treats Parkinson's disease. The banana stem is good for the kidneys. There are all these edible weeds. One of them is ponangani kere, and that's good for treating the liver, the blood, it's good for the eyes. This is a benediction of Mother Nature. And it led me to consider, you know, over the years of feeding people, of seeing the success of this very simple cafe, you know, where people come to eat from all over India. It's become very well known due to Instagram. And it's made me ask the question, well, you know, what is health? You know, where does health really start? And if we take the metaphor of a river, you could say that, you know, as health, you could say that upstream of the river, we have healthcare. And we have, you know, hospitals, doctors, diagnosis and treatments, etc. But at the source of the river, we have soil, plants, food, and so on and so on. You have people and society and culture. So if we look at the soil, we see that soil is really alive. It's a living ecosystem. Millions and millions of microorganisms, molds, bacteria, insects, earthworms, fungi, small animals, and the mycelium. The life in the soil is the fertility of the soil. Life is fertility. In Europe, they call her they call her Gaia. They worship her. In South America, they worship her as Pachamama. In India, she has many names. One is Bhumidev. But the soil is, in that sense, you know, in many ways is a divinity, but it's also a carbon sink, you know. It is a greater carbon sink than even forests. So soil is resilience. This is where our resilience starts, in health, in climate change, across the board. Soil is resilience. And we have a technique in Solitude Farm which is called chop and drop. And we return organic matter back to the soil. We grow plants like Mexican sunflower, Gliricidia, but equally anything else we can find, papaya, banana, coconut, everything gets returned back to the soil, building soil fertility, creating porosity in the soil, building carbon. You know, you even can start to see that this nutritional density of the soil is reflected in the taste. People come to our cafe and we serve a thali every day, and sometimes on the thali there's a piece of papaya, and people say, no, I don't like papaya. I say, try it. And they go, okay, I like papaya. That's because they never had papaya grown in a healthy soil. It's comparable to this hydroponically grown tomatoes. You have a tomato grown hydroponically, it's bland, it's tasteless. You have one grown in a healthy soil under the sun, it has a delicious taste, And you see that density of nutrition in the soil gives rise to, as I mentioned before, a diversity of plants with diversity of flavors, diversity of medicinal value, like this sundakai. This sundakai is a weed. It's an edible weed. And I think in Hindi it's called jangli bangan. So this guy here treats, all sorts of diseases from diabetes. I think it's good for your blood, for your blood, etc. So these diversity of plants, medicinal value, nutritional value, and flavors, and that obviously gives rise to a diversity of foods. Now, I feel really was inspired at one point to read this concept from the Upanishad, where they talk about the Annamaya Kosh, the Pranamaya Kosh, and the Manamaya Kosh. So obviously the food is the Annamaya Kosh, it's the food sheath. And that eventually gives rise to the Manamaya Kosh, which is the mind. And from mind emerges language. And language is a vehicle of culture. So you start to see our culture comes from the soil. So how we treat our soil actually defines how is our culture. And that culture means knowledge how to save seeds, knowledge of how to cook these foods. You find me someone doing C++ in fancy IT company, what happened? What I did, I shouldn't say that. You find the people who have the so-called successful job, they're not eating this. They're eating Swiggy. They're eating foods that are highly processed. They're eating the foods that create diabetes and all these lifestyle diseases. So you see that, culture is knowledge, it's belonging, it's cultural identity, and all that comes from the soil. Now you take industrialized agriculture, it compromises the soil completely. Plowing, heavy machinery, exposing the soil to intense sunlight and heat, compaction, chemicals. This industrialization of agriculture, which only sees food to be grown for monetary gain, but that's not the essential value of food. The essential value of food is nutritional. It's what makes us all equal here. We eat this sundakai together, we all go, oh, okay, but achhe hai, it's good food. And you start to see that, there is no health without healthy soil. So, yeah, industrialized agriculture can create more calories, maybe, with technology and etc. But food sovereignty is not nutritional sovereignty. Nutritional sovereignty is about your relationship with the land and with the soil and how we're farming. And you see that reflected in lifestyle diseases. In India right now, I think many of you will know, more than 10% of the population has diabetes. That's a shocking statistic. But you go back 40, 50 years ago in the village, there is no diabetes. Every day the ladies will come back from the fields, grazing the cattle and the goats there. What we say, the muddy, the sari will be full of all these edible weeds and spinaches. They cook that for their family. There's no diabetes. They live to a ripe old age. But now food is functional. You eat to go and log in, to earn money. You're part of the system, but that system has nothing to do with well-being. And then we start talking about climate change. You see, climate change affects ecosystems differently. If you have an ecosystem defined by industrialized agriculture where the soil is being compromised, then of course the effects of climate change are devastating. But if you have a farm like Solitude Farm with a resilient soil, full of life, and a diverse ecosystem of plants, which then reflects in a diversity of nutritional values, then climate change has a very, very different impact. Now, where we lose resilience, if you look at how that affects a society, actually it ends up with fragmenting a society. There's no common value for us. There's no sense of belonging, no sense of, you know, oh, this is my cultural identity. We're just running after the money. So problems created at the source of the river, unfortunately to say in a healthcare conference, they cannot be fixed by healthcare. Some years ago, I was invited, I think it was to do with the G20 summit, I was invited to a similar conference about climate resilience, and they had brought in professors from England, from some big, you know, university. Obviously, those Angresis, they know more, and they called them over. And they gave their speech, I gave my speech, and I said to them, you know, do you guys like, talking to the Tamil audience, you know, do you guys like Moringa? And everyone, you know, shook their head, yeah, we like Moringa, that's our culture, we eat that at home, we cook that. I said, great. Second question, does it grow on the campus? They said there were 10,000 students in that college. The campus is huge and it grew everywhere. Fantastic. Third question, do you serve it in the canteen? No. So you're running a climate change conference, fully aware that climate change is the major contributing factor, you know, industrialized agriculture, sorry, is the major contributing factor to climate change, and you're not serving something that A, you like, B, you know how to cook, and 3, you have it in your back garden. This is the ignorance, you know, that we're faced with, and there I see the potential for a change. There I see the potential for action. What if we could re-landscape ornamental landscapes into edible landscapes? Colleges, schools, corporate campuses, hospitals. What if we took one plant, let's say the Moringa?
Yeah, last 10 seconds.
Yeah,
good.
it's gonna go over.
10 seconds, yeah.
It's gonna go over. Even if you beep me, it's gonna go over. So what if you take the Moringa, you know, and planted that all over the campuses? It grows easily, it's highly nutritious, it's a medicine, and, you know, and start to feed people, you know, that local food, and you start to recognize that you're planting a menu. There is where the change can come about, you know. This is eating local foods, this is honoring a cultural heritage, and this is the work that I've started to do, working with individuals, working with corporates, working with hospitals and schools. I think that until we value the knowledge that we already have and recognize, you know, that our culture has emerged from this land, from Bhumidev, and it's to her that we should bow down, only then can we have sustainability, and we can have healthcare, and we can have well-being in our society. Thank you very much.
Yeah. Give a big round of applause to Krishna McKenzie. And you see, as he rightly mentioned, that this land is Veda Bhumi, Punya Bhumi, Karma Bhumi. As you know, one of the great Indian Ayurveda system has derived from Adharvana Veda. The ancient physicians, Charaka, Susruta, Vagbhata, they have all used all the natural plants have the medicinal value. But anyhow, Sir Vishnu sir, with your permission, can I ask any questions from audience? 1.5 questions, sir. 1.5 question. Okay, right, yeah. Yeah, because half questions from front row, 1 question from back line. Yeah, please. Because they're very friend now, sir. From the back, 1.5 question. Okay, now the session is open for the questions session, but anybody would like to ask any questions? Only 2 questions. Yeah. No questions? Yeah, because who is that? Yeah, please give the mic. Give the mic.
Hi, good afternoon. More, it's an observation. Can you throw some light about your dress code? Is there any relevance for what you do?
So I think that the speech is what you should focus on. Whether I dress in a suit, whether I dress in a veshti, a lungi, a turban, that doesn't change what I've said, sir.
No.
Yeah.
What I mean to say is,
No,
is there any connection between? Is there any connection between barefoot
Sir,
walking?
where are you from,
many things,
sir? Where are you from, sir?
I am from Hyderabad.
So farmers in Hyderabad area, what did they wear?
So just to represent community.
Not represent.
I'm really glad.
This is what I wear every day.
I really admire the way you have really uttered
Sir,
yourself. That's why, as a compliment, I asked this question. Thank you very much.
We look at the unimportant thing, you know. Shakespeare said, A rose called by any other name will still smell as sweet.
Yeah.
Thank you.
Another question? Any next question? Yeah, but Krishna McKenzie sir rightly mentioned that if you go to any Hyderabad schools, you all agree, school children, putta forward, chest backward. No physical exercise. Zomato and Swiggy, they have taken all our kitchen. Okay, that's true. Whether you like it, we don't like it. We should appreciate him because we are supposed to wear the same attire. But no, you see, my attire is, I'm moisturizing myself, but he's reminding, you are an Indian, you wear this attire. We should appreciate. Okay. Any more questions?
Yeah, one small.
Yeah, please, one.
Here.
One small question. Wait.
Dr. Ramesh.
Yeah, Suresh.
Yeah.
Sir, please, please.
Long back, I think 450 BC, father of modern medicine, Hippocrates, said, thy food is thy medicine and thy medicine is thy food. See, today we are relying more on medicines. We need to rely more on food actually. That was the philosophy there. But I feel that it has become more and more relevant now because I have observed that most of the diseases can be got into remission or reversed by proper nutrition. And nutrition without using any pesticides or insecticides, these things. So what is your take on that, sir? How do you promote that on the insecticides and pesticides and fertilizers?
Thank you for your question, sir. That's exactly what this speech was all about. Unless we change the way we are farming, that means moving away from monocrops, moving away from intense machinery that compromises the soil being the life of the soil, being Bhumi Dev herself, then there can be no health. Healthcare cannot address problems that are created at the source of the river. So that's what I'm saying. Solitude Farm is an example of a regenerative agriculture that's actually a regenerative healthcare in many ways as well.
Yeah, give a big round of applause to our Krishna McKenzie. Thank you very much, sir.
Thank you,
At
sir.
least you reiterate, you all the farmers, please move to the organic farming rather pesticides. Yeah, sir. 1 second, sir. Yeah, it's my privilege to present a small memo for you, sir.
Thank you, sir.
Thank you, Dr. Ramesh and Mr. Krishna McKenzie. Force for good. Why cross-spectrum teamwork and partnerships are critical for system-level change towards sustainability. I now brace you all for a panel discussion, and to chair the session, I would request Dr. Rajnarayan Tiwari, Director ICMR-NIREH, and Dr. K.H. Palin, Help Regional Lead Northeastern Region, to co-chair the session.
Hello.
Okay. Good afternoon, everybody. This is an important session, but then comes with a disadvantage of post-lunch hangover. So, but then if we talk from the perspective of sustainability, this is one system which talks about the ground reality. because we also are working as an environmental health institute. We are working, and we, in our day-to-day work, we feel and we see that these silos exist. Now, since in the morning we are hearing that the healthcare sector is both a culprit as well as a victim of the climate change and its effect. But then when we say we are culprit, and if you further see the emissions which are we are contributing, large proportion of healthcare emissions is through the energy use. And are we going to address ourselves that issue? Definitely not, because we require other sectors to help us, so that whether it is energy efficiency, whether it is the renewable source or any other source of energy, other people are going to help us. Same way, when we say we are victim and when we bear the burnt of the extreme events which are happening because of the climate change, again, there are many things which we need to do, and then that is to be addressed through partnership. Whether it is predicting something, whether it is forecasting something, whether it is showing the population trend. But practically, when we go for climate change and see these silos, sorry to say that, but then for that, health sector themselves are also important. Because when we conduct research in the field of climate change, we find that the hardest data to get is the health data. You can get other data easily, sources are there, through request you can get that, but then most of the time the hardest data to get is the health data, whether it is morbidity data or mortality data. So we again don't feel that, that we should be partnering with other people so that something good can come. And then it is not that when we talk of sustainability, it is the reactive actions. We have to be proactive action. And when we want to have this proactive action, definitely we require the help of the meteorological department, we require the help of the environment department, so that whatever trends which we are seeing in our healthcare setup, that can be correlated with the changes which are happening in the environment, and so that we can forecast, we can predict these things and prevent those morbid condition or mortality conditions. So with this, I think I request my co-chair to invite our eminent speaker of the panel.
Hello. Good afternoon. Today's topic is From Silos to System, Collaboration for Resilient and Transformative Healthcare. For this important topic, we have 4 panelists, distinguished panelists. I would like to call upon Mrs. Norley Grace Mercado, Healthcare Without Harm, Southeast Asia. I'm delighted to introduce Merle, Executive Director, Healthcare Without Harm, Southeast Asia. Please. Please sit on the chair. Southeast Asia, with nearly 30 years of experience in development work, she has led a multi-country program, national campaign, organizational growth initiative advancing climate justice, indigenous rights, natural resources management. Based in Philippines, she holds a degree of public administration and organizational development from the University of Philippines. As Executive Director, Norley guides Healthcare Without Harm Southeast Asia Strategy Direction, strengthening healthcare role in protecting both people and planet, and building on more than 2 decades of progress in climate and sustainability. Welcome you, sir. Amen. Next, I would like to call upon another distinguished panelists. Dr. Vivek Singh, UNICEF. May I invite? Dr. Singh, Vivek Birendra Singh, please. Lead national professional in healthcare team at UNICEF India with over 20 years of global experience across government, academia, United Nations agency. He has contributed significantly to public health policy, program implementation, health system strengthening. Okay. He also holds an adjunct faculty appointment at Emory University, Rolling School of Public Health. Thank you for joining us. Next, another very important and distinguished panelist, Mrs. Ambika Singh from NDTV. I'm delighted to introduce Mrs. Ambika Singh, Deputy Editor, please. And the senior anchor, NDTV, with over 12 years of experience. She has led impactful projects and campaign addressing critical health, social, and development issues. Thank you. Fourth panelist, right? Sorry. Next, the last fourth panelist, Dr. Merle Fernandes. Oh, please. I'm delighted to introduce Dr. Merle Fernandes, Green Team Leader at LV Prasad Eye Institute, Hyderabad. Thank you. Welcome all. Please address the gathering one by one for 4 minutes. And I would like to say that Mahabharat can be told in 5 minutes. So let us give the time. Thank you. Please.
We can start.
Dr. Norley. Dr. Norley first.
Can you hear me? Good afternoon. I'm not a doctor, but I'm very passionate about the intersection of health and climate. I'm Norley Grace Mercado. I'm with Healthcare Without Harm Southeast Asia, and I'm so happy and so honored to be here with you at the moment. So I wrote down my script so that I will be on time. So let me read the script. Health systems cannot become resilient in isolation. The climate, environment, energy, water, and the healthcare systems are all interconnected. If we continue to solve the problems in silos, then we continue to manage crises rather than prevent them. The future of health does not depend only on hospitals or ministries of health, and I think we've heard that previously in the different sessions. It's also shaped by decisions made in energy, transport, urban planning, food systems, waste management, and even the finance sectors. In fact, most of the most powerful public health interventions may never happen inside the hospital at all, For example, in the Philippines, more and more health organizations are actually engaging in discussions and policy interventions related to air pollution and the climate crisis, and even energy and the energy policy of the country. This is because they know that reducing emissions can prevent thousands of illnesses before patients even reach the hospital bed or the hospital door. On the other hand, the climate crisis is also exposing the limits of siloed approaches. Climate impacts do not arrive as isolated health problems. Heat waves, air pollutions, infectious disease outbreaks, and all of the things that we heard earlier are interconnected challenges. So now, if these challenges and risks are interconnected, then our responses must be interconnected as well, isn't it? Healthcare systems are often forced to respond to consequences of the climate crisis, therefore putting burden on the health practitioners as well as the health facilities. But we need to invest more in preventing those impacts by addressing their root causes, whether that's air pollution from fossil fuels or dirty energy, poor urban design, or environmental degradation. Within the climate crisis, we should always remember this. Resilience is not built during a disaster. It has to be built before it comes. Through the work supported by the Green Climate Fund and Save the Children, Healthcare Without Harm helped the Lao government localize and pilot the climate impact checkup tool, which is a tool which we developed as Healthcare Without Harm. This process helps health facilities in the country assess the vulnerabilities and also have concrete and practicable solutions to strengthen the resilience in case of the excesses of climate disaster comes. Across Southeast Asia and also here in India, I've been hearing good interventions this morning. We are also seeing hospitals reducing plastic use, strengthening climate resilience, measuring emissions, reducing waste, and implementing sustainable procurement. Now, these are not just environmental projects, they are health protection strategies too. At Healthcare Without Harm Southeast Asia, we have also seen how partnerships can become powerful drivers of change. We've heard about GGHH and HELP, so these are a few of the platforms that are very important for you to talk about the problems and to talk about solutions. There's a certain special magic to hearing from your peers about inspiring models which can be replicated in other countries. For example, a very good project in Malaysia had inspired a hospital in the Philippines. Aside from the group of green and healthy hospitals or HELP, there's also a lot of things that can be improved in terms of strengthening the health practitioners network all over Asia and all over the globe. Here in India, I know that there's a Doctors for Air Pollution and Climate Action. I'm sorry if I'm getting the name incorrectly, but and there's a similar platform in Southeast Asia as well. So these platforms ensure that the credible voice of health practitioners are heard, because when the doctors, health practitioners, nurses speak, the public listens. So basically, to wrap it up, what I'm saying is that since the problem is systemic, the response that we have to have is also systemic. And this includes breaking the silos, having more coordination, and having more accountability in terms of having a common vision for a solution. Thank you very much.
Next, I would like to request Dr. Vivek from UNICEF to address the gathering from your perspective.
We had a written speech, but then the other speakers were so thought-provoking. So the UNICEF works in states, as in like India and other states across the globe, because of the most widely ratified, near universally ratified legal document. I'm sure some of you or many of you would be aware of the Conventions of the Rights of the Child. Except for one country, the United States of America, every other country is a signatory to this. And here is a fact about environment and climate. So when this Convention of the Rights of the Child, whereby based on the deprivations that can affect children, when it came into being in 89 and that period, obviously many of those determinants of deprivations wouldn't exist. So after CRC came into being, the Global Child Rights Committee, by virtue of what is called the general comments, adds the deprivations through which these signatory countries then become obligated to protect their children. And the general comment number 26, which was the topic of discussion in 2023, that has formally put climate and environment related hazards as a deprivation which needs obligated commitment from the states. So this is a time when we all, I remember this very clearly. My dad was working in Pune, and we were thinking of settling in Pune because of the lovely weather there. And on a particular road, although we ended up being in Pune, there was an apartment called Hillview Apartment. But by the time we decided to finally buy a house, the apartment's name was Hillview, but there's no hill view actually now. Same, I want to invoke this by my own understanding, that when it was a discussion about health, I wouldn't think of hospitals. I would think of hospitals when it was only about disease. Now, when we started this portfolio of program on climate and environment and health, and I was told as the leader of the team in India, we have to start working with hospitals. And my total ignorance at that time that how this can be health promoting, as you rightly said. So for example, the COP26 commitments of India also, if we have to reduce 45% GDP carbon intensity, 10% of that comes from hospitals and health facilities, 10% of that. So hospitals do have a role to play, and they can be health promoting hospitals. Another important fact we must understand, and I want to quote Professor Srinath Reddy, who's been a mentor, and in fact, I was privileged to be part of the first 13 people with whom Public Health Foundation of India started. Professor Reddy always said that public health does mopping up of policies gone wrong in other sectors. That is why when we are discussing today that this kind of an environmental and climate deprivation that has come for the population, not just for the children, it will need an approach which is not siloed and which will need whole of society. And take the example of those who are doctors or related to health field. When we studied about the triad of disease, the agent, host, environment, we wouldn't even, at that time, we wouldn't even apply it to any other disease but infectious diseases. But look at today, these are determinants of diseases. But when it comes to the determinants of health, that's a ecology of plethora of multi-level things, which produces health. And I think that is why we do not need siloed approach. We need the whole of society to come together. I'm glad I'm part of this panel. Thank you.
Hello. Thank you. Next, I would like to request Dr. Merle Fernandes, Green Team, LV Prasad Eye Institute, to address the gathering.
Yeah, okay. So good afternoon, everybody, and it's a pleasure to be here. I'd like to thank the organizers. So LV Prasad Eye Institute, I'm not sure if everybody is aware, as the name suggests, Eye Institute, but it's much more than that. And essentially, when it started off in 1986, it started off in Hyderabad. However, the center in Hyderabad is not what we are known for. We are known for our pyramidal model, which extends all the way to one of the most remote villages in the tribal areas of Orissa, to a small secondary center in Bellary. And essentially, we are located in over 318 locations. Why is that relevant? It started off as vision technicians, people who were pulled out from the local areas, who studied +2, whom we hired, trained for 2 years, and put back in these vision centers where their job was to screen the population. So what does that do? Essentially, we're trying to find disease before actually it comes in, right? And so then these vision centers, 10 of them fed into a secondary center, which was manned by an ophthalmologist in a tier 3 or a tier 4 town, where a lot of ophthalmologists would not set up shop. And so there was where we were able to tackle very basic surgeries. And then more complex cases went up to the apex centers and the tertiary centers, which are located in Vizag, Vijayawada, Bhubaneswar, and Kadapa. So what's the relevance of all of this? Essentially, it hit us when COVID struck. And so that's one of the, the times when a lot of us struggled. But what we realized during COVID was that this pyramidal model that we had established, where we see patients who can afford treatment or who cannot afford treatment, they're seen with the same quality of care. They can avail of all kinds of procedures, regardless of whether it's the simplest or the most complex. And in COVID time, when there was a lockdown and none of our patients could get to us in the tertiary centers, the vision centers, the secondary centers, they were a blessing in disguise. And so from there stemmed our teleophthalmology project, where we overnight, or actually a couple of weeks into the lockdown, we decided that if our patients were not going to reach us, then we would have to reach the patients. And so we developed our own indigenous Connect Care platform, where patients would come to the vision center or just get onto a call with the doctor. How did that help? So when we just looked at a small pilot, the number of patients who avoided traveling from a vision center to a secondary center or from a secondary center to the tertiary centers was a huge number. Over the last 5 years since we've established it, we didn't just stop at COVID, we have continued that. So we have avoided travel for over 500,000 patients. And a majority of those are from the vision centers. So what's the significance of all of this? So if you look at the travel alone, the carbon dioxide emissions that were averted by these patients not having to travel was humongous. I don't remember the number, it'll come up in a later slide because we got the award for this work. But essentially, the travel, the fact that there's no loss of wage for an attendant to travel along with the person, the back and forth that would have happened, that all was averted. So this is something that can be adopted, not just by eye health, but by various other specialties, because it's a model that can work. It's a self-sustainable model where we have paying as well as non-paying patients. The ratios vary from place to place, with 80% of our patients being seen absolutely free in the remote rural areas, and 70% of the patients who can afford to pay would be seen in the tertiary centers, and that cross-subsidizes. So that's exactly how it works. So this, and in addition to that, what we decided was we would work towards reducing our carbon dioxide emissions. So all our campuses are green. We have a lot of vegetation, much as what you see here on the 7th floor, which is amazing, the big trees out there. But all our campuses contribute to several thousand reduction in carbon dioxide emissions. And also solar energy is something that we're very heavily invested in, amongst other things. But essentially, it was a journey. This is my last sentence. This is a journey that we have taken with a lot of research that has gone into it. And what everybody has been talking about, silos, we have realized that it's not just an eye hospital alone that can do this, but you require information, you require help, you require advocacy, you require government support for a lot of the things that you do. And that's where it's important for discussions like this to bring out the problems that we have, the models that have been created, in order to ensure that everybody is on the same journey towards attaining sustainability.
Wonderful. Thank you, ma'am. Next, I would like to request Mrs. Ambika Singh, NDTV special project,
Thank you so
to
much.
gather this address the gathering.
Thank you. I think I'll just like to add on. So I've never really been on this side. I've always been moderating some on the other side, like yourself, who's asking questions is a little different and unique for me, but I'll give it a shot. But good afternoon, everybody. It's indeed a pleasure to be here and to be talking about something which really needs to be the center of the conversation. I have some pointers where we're talking about resilience, we're talking about transformational healthcare. And as the topic is really from silos to systems, this really captures two aspects, right? It also shows us the challenges. We've been talking about the challenges, but it also shows us and showcases the opportunity that we have in front of us. So very long, I mean, I've been covering health for over 10 years and, which actually started with the Swachh Bharat mission. And then you realize that cleanliness is just not about cleanliness. It's just not about making toilets. It's just not about open defecation-free India. It definitely is linked to health as well. When we started bringing about the connection, we started realizing there were studies on the ROI, return on investment on health. That's when you realize they're connected. And obviously, it's deeply connected to money as well, to finances as well, key, which is economy. Right, but for very long, healthcare has been looked as a silo. We've always compartmentalized things like, okay, it's a hospital, it's their problem, policymakers need to do their thing, and sustainability was never really part of it. Unless, like in the morning, we've heard so many sessions. In fact, we've also seen what all is being done and how are you accrediting hospitals as well. I had the opportunity of covering one such hospital in the capital. I'd gone to Apollo Hospital, and of course, Gina was there with me. Karan, who's here, was there as well. And it indeed was an eye-opener that, yes, hospitals are trying to do what they need to do. We don't realize that what all happens. Yes, through the morning we've been talking about hospitals are trying, they get it from both sides, right? If there is a climate adversity, if there are floods, they're trying to actually help people as well, but they have their own challenges. If there is a water shortage in a city, they still need to, work. So they have, while they are generating, they are creating waste, they are using energy. So they're part of the system in either way, but they are working. And that shoot for me was definitely an eye-opener that how hospitals are doing their bit, and they still need to do a lot more. We've also heard in the morning that how case studies like a hospital in Chennai or Bangalore, hospitals like that can make a difference by bringing about a change. So I think it's about working together. Well, when we break silos and build systems, obviously we connect each and every aspect. We connect health with climate. Most importantly, we connect communities. And the main core here is, of course, sustainability. I've spoken about economy and health. I think I've spoken about how health is connected to climate change. We're all witnessing climate change ourselves, but we need to also think about the future generations. We all need to work together, and as this whole conversation really is about collaboration, how each one of us can come together. And, earlier in the day, Meghna also spoke about, as media, what responsibility we hold. Are we trying to sensationalize news? Are we trying to say, oh, this is where floods has happened or drought is happening? Or what really our responsibility is to kind of make people a part, make them part of this journey. I think it's important for us to tell people that you need to come and share your story. You need to be part and actually be a part of this change as well. We have spoken about how the healthcare sector does contribute, I think 4 to 5%, if I'm not wrong, to the global emissions. That's about 4 to 5%. So definitely we together need to work together to ensure that a change has to be brought out, because indirectly it is going to impact us in every way. So I think, as a society generally as well, we are living in silos, and we were talking about climate and health today, but whether it's education, whether it's environment, whether it's economy, even as media, very often we cover it in silos, right? That's what you need to cover, but it's all together. So I think when we start doing things together in collaboration, it definitely can bring a change.
Thank you very much. Another round of applause. Now we will have a round of question answer. So first to Norley Grace Mercado. Mrs. Mercado, looking at Southeast Asia and India specifically, what are the primary systemic roadblocks preventing traditional hospital administrators from transitioning away from resource-intensive silos and embracing a systemic green operating model. Please.
Thank you. Based on our conversations with hospitals and health facilities in Southeast Asia, we see that the biggest barrier is how the health facilities are structured and are incentivized. So number one barrier that we saw is how facilities are operating with significant financial pressures, especially for the smaller hospitals. The immediate priorities, of course, of these hospitals will be to save lives, right? To make sure that there are salaries for their staff, or to fill in shortages of the staffing, accreditation requirements, and budget constraints. So that's the first for us that we saw, major constraint. But we've been hearing this morning, since this morning, that the solution there is to really shift the mindset, especially of the leadership. We've found that even in the smallest hospitals and least resource hospitals, if the leadership is really has a vision of sustainability and really sticks to it, there's something that they can do even if it's a very small step for a start. The second roadblock that we see is that decision-making in health facilities, especially in bigger hospitals, are fragmented. So for example, someone decides on procurement, another one decides on building infrastructure, and another one decides on the finances, etc. So let me give you an example. For example, switching to single-use gowns to a reusable medical textile. That would, different departments would have different appreciation of that. So not unless there is a common goal and common understanding of the problem and the solutions, then there will be a longer-term process for decision-making. Now, what we see as solutions there is to create cross-cutting working groups or management teams so that they can have a space to discuss all of these problems and see where each department is coming from. The third roadblock that we see is that there is always a perception that sustainability is expensive. Because for hospitals, as we know, we are constrained by the budget cycle. The budget cycle usually is for a year. And what you see, and what is expected for a year is what is your ROI for a year. And when you invest, for example, in a solar panel system, the ROI doesn't come in a year. It comes in 10 or 15 years. So it's not embedded in the financial and fiscal management system of the hospital. Now, the solution there that I see is a shifting of the framework that we, and someone talked about this, that we see this as not cost, but as investments. So shifting the sustainability framing. The last one is on policy and financing, which has not caught up with the changing signs of the times and the needs. But I'm very happy that hospital accreditation has started here in India to include sustainability as part. But in most countries, for example, in Southeast Asia, that hasn't happened yet. So in that case, India is far more ahead in terms of sustainability framing in health facilities. Another one is that financing mechanisms do not regard or do not actually give too much emphasis on sustainability. And for this, we need development banks, we need private financial institutions, we need philanthropies and foundations to help hospitals, especially the smaller hospitals who have no resources. So yeah, those are the four.
Thank you. Thank you very much. Next question goes to Dr. Vivek Singh, UNICEF. Public health system, especially at the primary level, care level in India, are highly vulnerable to climate shocks. From a systems perspective, how can UNICEF and the government bodies ensure that rural health infrastructure is integrated into a national climate adaptation plan? Please.
That's a very pertinent question. So, two things to put this question in perspective. India started its National Action Plan on Climate Change and Human Health in 2018 and National Plan for Climate Change, the National Program for Climate Change and Human Health in 19, whereby every state is mandated to have a climate and health action plan bottoms up. Every district is mandated to have a plan. So for example, through our 13 field offices of UNICEF across 23 states, I was just apprised that the states of Telangana and Andhra Pradesh here in India, they did this bottoms-up district-level action plan for the national program in collaboration with the state governments and UNICEF. The universal health coverage quest for the country in India, for example, started with this program called Ayushman Bharat that has about 170,000 health and wellness centers, many of which are now becoming health promoting, talking about climate and environment and things that are affecting population and how to adapt to them, and also solarization of these units. So government is partnering with UNICEF and multiple other agencies to start from the front lines for adaptation. Because we know, as is being talked since morning, these are poverty accentuating effects. And it is the most vulnerable, the most difficult to reach population that are getting affected. So there is the architectural framework, there is national programs, at least in the context of India. And then government is collaborating with agencies, UN and other civil society organizations to do this bottoms up using this framework of national programs to converge all partners.
Thank you very much. Next question goes to Mrs. Ambika Singh, NDTV Special Project. We have all covered most of the areas, but my question is, mainstream media frequently covers health crisis and climate disasters, but rarely the intersection of the two, like sustainable healthcare. From a media standpoint, how do we break the communication silos to make green hospitals a matter of public interest and the consumer demand? Please.
So I wouldn't fully agree with what you said, because yes, we do, mainstream does cover, but personally for me, that's why it says special projects, because I've been covering a lot of positive stories, case studies, which inspire and motivate each other. So, I mean, yes, but from the mainstream, since I'm, talking from a media perspective, it's important that that change has to happen, the pivot has to be made. But while breaking news would be that if floods has happened or there is a drought or something which has happened has to be there. It doesn't need to be sensationalized. I think that is the most important. And I think today media companies are understanding the impact around it. But then there's also social media, which has another angle to it and makes it even more, I think, difficult, right? But when it comes to talking about, see, what media does is also it connects all the dots, I feel, right? It's about showcasing what's happening out there, putting across the right story. But I absolutely agree that we need to show the real stories. We need to show hospitals which are doing a great job. We need to show case studies, or we need to show what can be done. A lot of hospitals in smaller, like Dr. Vivek said about, somewhere healthcare is not accessible to many parts of our country, unfortunately still. Our doctors, we do not have enough manpower, whether it's doctors, nurses, staff is also a challenge. Well, while we are grappling with that, but in smaller places, they do not even know what needs to be done to actually bring about a change. So I think that intersection is there, but yes, as media, we definitely need to be more responsible as to what we are showing. There is enough negative news anyway. So let's look at the positive stories and give people some hope. I think that's the takeaway for me.
Thank you very much. Next question to Dr. Merle Fernandes. Your hospital is globally recognized for demonstrating that high volume, world-class clinical care can actively coexist with green, low-carbon strategies. What was the internal cultural shift required to get your clinical green team out of their medical silos and into operational sustainability, please?
So I think for us, it was a top-down thing. So essentially the senior management, the founder of LV Prasad Institute, Dr. Rao, and subsequently the executive chair who took over from him, where it was decided that if this is the way we're going to go to save the environment, then that's what we have to do. And essentially it was and all-out effort that was made with kind of whatever strategies that we wanted to implement. If the team decided that this was the way to go, then that was what we did. So essentially, we've invested heavily in solar, because you realize that solar energy is one of the ways that you can help reduce your emissions, because it's a clean fuel. But ultimately, when you look at how much you need to invest for solar, and as Ms. Norley was pointing out, that the ROI is not very lucrative when you think of it from that standpoint, there's a lot that has to be done. And for us, the shift was knowing that we had support from the management to invest in whatever we wanted. So it was solar, water harvesting, recycling, as well as other measures within the network, like water conservation. So all those efforts have been put in. And when you look at the spread of organization, I think we've not reached down to the grassroots. I hope that by 2050 we should be able to say that we are like net zero across the network, but we're slowly getting there. And awareness has also played a major part, because now everybody knows what the green team is up to. So if they find that the flow of water is less, or that the lights have been turned off, we are at work.
Thank you very much. On time. Next, I would like to request from the audience 2 or 3 questions. Please. It should be short. We are running out of time.
So my question is to Madam Singh. Whenever you are reporting any disaster, like in medical, whenever there is a disaster in our hospital or any sentinel events, we go in for the root cause analysis and give some message that it should not happen. So my simple thing is this: you report so much, but what should be done and why it has happened should also be reported.
You're absolutely right, sir. The aim is obviously to give the right news, right? When anybody is trying to cover, any journalist, any media person is trying to cover, the aim is always, the intent is there. Now, whether it's happening, I cannot say for everybody, but the intent definitely is there to give the right news, right? The basics of 5 journalism, who, what, where, how, we do try to follow that. And I think what you're doing is perfect by giving the exact reason. And I don't have I really can't tell you why it's not being done. But mostly, like I can talk for my media company, we try and give the right news where it's possible. That's why NDTV says that's why it stands for trust.
Any other? Okay. Thank you all the panelists for the nice and very productive discussion. And in fact, India's healthcare faces double-edged sword. It's highly vulnerable to climate change. At the same time, the rapid expansion of the healthcare infrastructure contributes heavily to carbon emission, intensive water use, and a massive quantity of biomedical waste. And clinical outcome, healthcare administration, public health, policy, and environment management should work together. Now, currently, it is independently working. And last year, we had 2 hospitals to submerge underwater, and we had to shut down for two months, almost 2 months, because of the flood. So with these few words, I thank and congratulate all the panelists and my chairman and all the audience for the patient listening. Thank you very much.
Thank you so much, sir. I would now request Dr. Rajnarayan Tiwari to please present the mementos to the panelists. And Dr. K.H. Palin to kindly present the memento to Dr. Rajnarayan Tiwari. Thank you, everyone. We have amongst us Mr. Suresh Gupta, who has contributed immensely to sustainability and environment health. I would come up the stage and share a few words.
అయ్యో దేవుడా అమ్మా భూతల్లి క్షమించమ్మా అమ్మా నీ దరిద్ర దినోత్సవం నాడు సూదులతో కుచ్చుతున్న ఈ మనుషులు వీళ్ళని ఏమనాలి తల్లి అమ్మా మమ్మల్ని క్షమించు తల్లి.
Anybody tell me what is the middle of the video?
రామ రామ.
What is that? Yeah, that is hospital injection needles dumped on the national highway roadside.
అయ్యో దేవుడా
While I am traveling to the Hyderabad,
అమ్మా నీ దరిద్ర దినోత్సవం నాడు
जो मेरा ट्रैवल कर रहे हैं वो बस ट्रैफिक में जाम
अम्मा
तो उस टाइम मैंने बैग पे जैसे आज हेल्प ऑर्गेनाइजेशन से सीड बॉल्स दे रहे, मेरा बैग पे सीड बॉल्स है वो थ्रो कर रहे. उस टाइम पे मैंने रोड के जो सामने देखा था पूरा हॉस्पिटल का इंजेक्टेबल्स नीडल्स उसमें थ्रो कर दिया था. मतलब डेली मैं पर्यावरण के लिए इतना सोचती हैं. एनवायरनमेंट का मतलब है पानी पौधा पॉलीथीन नहीं, ये वे ऑफ लाइफस्टाइल. तो इसके बारे में मैंने सोच के 2017 में जब तक मैं बैंक मैनेजर था, पहले मैं पार्ट टाइम हॉलीडेज में पर्यावरण के लिए काम करता था. आई रियलाइज्ड मेरा पृथ्वी को आग लगा हुआ है, तो मैं ये आग संभालने के लिए पार्ट टाइम काम किए तो नहीं चलेगा. इसीलिए मैंने सोचा था तुरंत ये पर्यावरण के लिए काम करना है. इसका जो अंबिका सिंह मैडम ने जो बोला था लोग को बुलाना है, उसका स्टोरी सुनाना है, कोलैबोरेशन बार बार स्ट्रेस किया था. यस तो मैंने सस्टेनेबल डेवलपमेंट के बारे में काम कर रहे हैं, तो आई एम रिक्वेस्टिंग यू, तो पर्यावरण के लिए अगर कुछ लाइफस्टाइल चेंज करना है ज़रूरत पड़ेगा, तो मेरा यही निवेदन है सब मिलके हम लोग को पृथ्वी को बचाना है. थैंक यू सर, थैंक यू वेरी मच.